I've been dealing with chronic pain for the last 4 years. I was having really sharp pain just going from my lower back into my left hip. I've seen lots of practitioners before. I was kind of being brushed off. Dr. Chris is different. This is the first time in a long time that I felt good.
Nisha is a lovely 36-year-old patient who is a mother of two and has had pretty horrible midline low back pain in her butt bone that wraps around the side and front of her hip for the last 4 years.
I think it started postpartum, immediately after I had given birth to my son and we came home. That's when I kind of started noticing the pain. I was having really sharp shooting pain just going from my lower back into my left hip. I was having trouble walking, standing for long periods of time, lifting my son, going up and down stairs, or even things that I enjoyed doing like going on hikes or walking for long periods of time.
What's interesting to me about Nisha is a lot of times people come in here and they say, Chris, my MRI is clean. Just because someone's MRI is clean does not mean that your disc is 100% healthy. You could have an 85% healthy disc or a 60% healthy disc, and not what a surgeon might say, a 20% healthy disc or a sick disc, and you need surgery. So Nisha had a healthy MRI, but really, really bad pain, which is super frustrating for people with chronic pain because they go to doctors and they say, oh, your MRI is clean, there's nothing I can do.
I saw a chiropractor, I went to a physiatrist, an acupuncturist, just my regular PCP to see if there was any sort of autoimmune thing going on. Really, I just wasn't finding any relief.
The good news is that Nisha had tons and tons of adhesion all around her low back, her sciatic nerve, her femoral nerve, her pudendal nerve, her iliolumbar ligament, all throughout her pelvis.
I would say on a scale of 1 to 10, when I first started barefoot, I was at probably a 10.
It took a little while. It took about 7 visits until she was 20% better, and then she jumped up to 50% better at visit 8, and then she was 70% better till visit 13.
On a really good day, I'm down to 3.5, maybe a 4. I think it was Casey that I had first met, and she asked me if she could hug me. And I was taken aback at first because I had just never walked into a medical practitioner's office and where they greeted me with a hug. After having met Dr. Chris, going through my medical history, my mental health history, my emotional history, I immediately felt like Dr. Chris was looking at the whole picture. He didn't dismiss any of the things that I had mentioned. He validated everything that I was feeling. And he told me from the very beginning that if he felt like he couldn't help me, he was going to be honest. Most practitioners, if I've told them that I've been seeing other practitioners or exploring alternative healing modalities, they would kind of scoff at it. And it was kind of hurtful, just because here I was trying to find a way to heal, and I was kind of being brushed off. Dr. Chris is different. I am able to go back to being physically present with my children. I'm able to go on short walks. When we travel, I'm not worried about being on my feet for a longer period of time. Overall, I'm feeling happier. I feel like I'm finding joy in a lot of the things that I wasn't really finding joy in before. Anyone that's been in chronic pain and in search of an answer, but hasn't found one yet, I think give barefoot a try because they're different. It's so different from anything else that's out there. And this is the first time in a long time that I felt good.
If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.